we're just trying to give some of the highlights of these systems and not able to go into all the detail. Our next presentation is by Karen Callender. She's a public health professional with specialization in health systems, child health epidemiology, 15 years of experience as a researcher and lecturer, program coordinator and consultant. So we'd like to invite her to tell us a little bit about the work she's been doing on in-scale, upscale in Mozambique.
Great, thank you, Eric. I don't know if my slides will show. Great. Okay, so I'm very honored to be presenting about upscale on the behalf of the Ministry of Health in Mozambique. I'm from Malaria Consortium, and we're providing technical support together with Unicef to the Mozambican government on this upscale platform, which is currently funded by UKA DFID. So this platform is really what we call an mHealth system strengthening platform. It's built around the community health workers, which in Mozambique are called upSCALE. And upSCALE have about 4 months training. They're trained in ICCM for around 6 days. They have a stipend, so they're paid, and they are they have a broad curriculum of services that they deliver. They treat sick children, they treat sick adults for malaria and diarrhea. They provide family planning, including Depo-Provera. They they go to the communities to give health education, health promotion messages. They visit postnatal and prenatal and postnatal women, including newborns, and they screen newborns for illness. And they also follow up HIV and TB patients. So they have a broad package of services to deliver. So upscale is really trying to address this whole package of interventions to strengthen the quality of care provided and the coverage of these services to the community members. If we look at current implementation, we are currently in 2 provinces, and we have trained the master trainers at Ministry of Health, who are now cascading out this training to currently over 600 upSCALE in the country, all their supervisors and all the district level coordinators of this program, including the statisticians, as well as the provincial level. So it's very much run by the government and Ministry of Health staff with just technical support from us at Unicef and Malaria Consortium. There are current expansion plans to ideally by 2020 to go nationwide. If we look at what's happening at the upSCALE level, which initially this system was designed for, we have provided simple smartphones with a diagnostic algorithm which covers all the modules of services that they deliver to patients. They also are part of a closed user group, so they can make calls for free to all their peers as well as to their supervisor at a very favorable package that we negotiated with the mobile phone operators. The mobile phone also has pre-recorded audio messages that they can play to the patients during the consultation. And individual patient data is instantly sent to a server whenever there's network available. The different modules we have on the phone are developed together in collaboration with Dimagi, so it's built on ComCare, an open access platform. If we look at what they contain, we have modules for case management, so depending on who the individual is, the individual patient is, different modules will show up. So it's a sick child screening form, sick newborn screening form, sick adult screening form, prenatal care, postnatal care. All children who they come in contact with have a nutrition and vaccination screening form. And as I mentioned, they also follow up HIV, TB cases to see that they don't default on treatment. And there are different referral follow-up forms showing up if the patient was previously referred. And the individual patient data, if there's a referral, those patients will be added to a to-do list, so to say, where the upSCALE can then plan the follow-up visits. There's also a household management form where they register all the households in their catchment area with GPS coordinates, and there's a checklist for sort of the healthy household behaviors. There's a stock management form so that all the medicines are updated real time. They also go out and do palestras, so health talks in the communities. So there's a form for registering health talks. They register all births and deaths in their communities. And there's a monthly report automatically generated in the system so that they can see what they have performed during each month that they can then transfer to the paper forms. Just also looking at the stock inventory. So they register all the incoming medicines in the phone, and whenever they treat a patient, it's taken automatically off that stock level. So there's always real-time data on each community health worker's stock levels. Then looking at the supervisor level, we have also developed an application for supervisors. So they have what we call phablets. There's tablets with SIM cards, so they can communicate with the upSCALE. They use this supervisor application, which has modules for scheduling a supervision visit. It has competency checklists for each of the modules so that when they observe a consultation, they score the performance of the community health worker and coach them on how to improve. There's also, in the supervisor form, monthly reports as well as stock levels for each individual. And at central level, I'm running out of time, but at central level, we're training statisticians at district, provincial, and national level in using the data that's coming in. And Mozambique is currently rolling out DHIS2 under the name SISHMA, and we are building an automated bridge so that the ComCare system can talk directly with DHIS2 so that the data can be used for forecasting or identifying needs. And just as an example, we're building a dashboard. This is not a Mozambique example. This is taken from the DHIS2 kind of demo, but we're planning a dashboard where planners can then see individual upHCALE data at district level, etc., to make better decisions. And that's in progress. We're currently developing that. Thank you. If you want to read more, there's a link here, and I'm available after this session.
Thank you, Karen. Next up in our lightning presentations is Hannah Housey. She comes